It did really sound like a miracle drug, the way they described it. You take it once a day, minimal side effects. The clinical trial they were running, they had to stop some of the testing for the placebo group because it was so effective. My name is Alex Hepner. I'm 25 years old, going into my final year in law school, Ottawa. I was having pretty debilitating headaches, so I decided to go into Mount Sinai Hospital. We opted to do a CT scan that day, and it came back with some tissue swelling. They said, oh, it's probably not anything you should worry about, but you should come back for an MRI Sunday. Fast forward to Sunday, I go with my whole family and I get an MRI done.
When he asked to speak to my son privately before us, that was when it was hitting us that we had some idea that it could be serious.
And then it wasn't until a few weeks later, I got a consultation with the surgeon. This is not something you're gonna be able to remove. It's actually like embedded in your brain. That's the nature of these things, and that there's not really any treatment other than just waiting. What they did say in this visit was that there is a second school of thought that's emerging in a more aggressive treatment strategy. And this is when the first time I heard the drug vorasidenib mentioned.
IDH mutant gliomas are really common, primarily in younger patients. The options have been surgery, radiation, and chemotherapy. This is a new therapeutic agent for this disease, and it is completely revolutionizing the therapeutic landscape. Advances in systemic therapies for primary brain tumors are few and far between, and the development of IDH inhibitors for primary brain tumors is probably the most significant advance therapeutically in about 2 decades.
I took their advice and I said, let's do the more aggressive treatment. So this entailed a minor procedure, as minor as I guess brain surgery can be.
He underwent pathological diagnosis by biopsy. We were successful in getting enough tissue for a diagnosis and for identification of the IDH mutation.
I took first 3 weeks off school, but then I decided to return with a reduced course load because the way I've tried to approach it from the outset has been to continue living as normally as I can.
I mean, I cried for 80 days straight, just not knowing. It was the worst time in our lives. We were scared.
Yeah. From that point on, I guess I just wanted to do my best to be, strong for them, because it was honestly the hardest thing was just seeing the impact it had on them. It was pretty devastating. I got the call, probably the best phone call I've ever received in my whole life. The DNA came back and I'm eligible. I started taking the drug October 30th, 2024. The manufacturer has to list a bunch of potential side effects, but to be honest with you, I really haven't noticed any of them. The main thing they monitor is the liver enzymes. Some liver enzymes would spike and then they go down, and then they'd spike and they go down. Never to the point where they ever even contemplated taking me off the drug. But at the same time, I was still trying to figure out what things in my life are impacting the drug. What do I have to change? Can I go out with my friends on a Friday night? And I like to play, soccer in a league with my friends. I still like to play hockey. Those were 2 things I wasn't sure if I was going to be able to even continue doing.
Alex is doing very well on treatment. He's tolerating it. He's clinically stable, and his MRI is stable.
Now that everything's kind of stabilizing, I can kind of envision a future again. I can picture what my life looks like in, 20 years, 30 years. It really does feel like I'm living as close to a normal life as I can be.
And we hope that with funding and further research that new treatments, new approaches will be developed, and that my son will have a normal life, because as a parent, you think about children and you think about marriage and all the other stuff that he should have, and we think that this drug is a critical step for that process for him.
I'd like to think that I'm a walking, talking example of what a difference this research can make.